This lecture is going to be on urine pH. Urine pH is an assessment of a metabolic acid-base status. Normal urine pH is dependent upon the species. Carnivores have an acidic urine pH, herbivores have an alkaline urine pH, and the urine pH of omnivores varies with their diet. The urine pH and the TCO2 both reflect the patient's overall metabolic acid-base status, so the TCO2 and the urine pH are expected to increase and decrease together. However, there are 3 instances in which the urine pH will not match the TCO2. First, the urine can be stored in the bladder for several hours, so the urine pH may reflect a prior acid-base status, whereas the TCO2 reflects the current acid-base status. Second, the presence of urease-producing bacteria can make the urine more alkaline by converting urea to ammonia. And lastly, the patient may have paradoxical aciduria. Paradoxical aciduria is the production of acidic urine in the presence of a metabolic alkalosis. Paradoxical aciduria occurs when there is a total body depletion of chloride and potassium, and there is a drive to conserve water due to a decreased blood volume. This trifecta most commonly occurs with upper GI obstruction and loss of a large amount of hydrochloric acid in water. The picture on the right shows a blood vessel and a renal tubular epithelial cell, as well as the ultrafiltrate, which will eventually become urine. In the drive to retain water, the tubular cells resorb sodium from the ultrafiltrate and water follows. Chloride also follows sodium to maintain electroneutrality. However, if there is a total body depletion of chloride, then bicarbonate follows sodium instead of chloride. This ends up worsening the metabolic alkalosis. Also, in the drive to retain water, the tubular cells resorb sodium in exchange for potassium, and water follows sodium. However, if there is a total body depletion of potassium, then hydrogen ions exchange for sodium instead of potassium. This also worsens the metabolic alkalosis by the excretion of more of these hydrogen ions. And so, paradoxical aciduria is actually a severe form of metabolic alkalosis. This is a summary of the metabolic acid-base disorders that you have already learned. A metabolic acidosis can be caused by the presence of an excessive amount of acid, which is called a titrational metabolic acidosis, or by the loss of bicarbonate. If bicarbonate is lost, then that's called a secretional metabolic acidosis. A titrational metabolic acidosis is identified by an increased anion gap, and the identification of a secretional metabolic acidosis is identified by an increased chloride relative to sodium. Metabolic alkalosis is typically only caused by a loss of hydrochloric acid, but it can be iatrogenic if the animal receives exogenous bicarbonate. Metabolic alkalosis, due to hydrochloric acid loss, is identified by a decreased chloride relative to sodium. So these are all simple acid base disorders, meaning that there's only one primary process. However, if you have a mixed acid base disorder, then you can have more than one of these occurring at the same time. So there can be a titrational metabolic acidosis with a secretional metabolic acidosis, or you can have a titrational metabolic acidosis with a metabolic alkalosis.